All right, JC, your name's been mentioned enough. Love to hear, like I said, about mental health first, by me particularly. Mental health first aid, the work you're doing in Ordway with the school, other efforts. You've been a real innovator. These are challenging times, but they call for innovation to respond.
Thank you. JC Carrica, Valley White Health Systems. Previously, we were Southeast Health Group, Southeast Mental Health. I agree with everything that's been said so far. I also serve on the National Council for Mental Well-Being, serving the 7 states out here. And one of the statistics that caught me when I was out there 6 weeks ago was that by 2030, we can anticipate being short 30,000 counselors in the United States. The trending is not in our favor. And so what does that mean? It means we can't continue to just lean on licensed providers to try to fix this problem or even stabilize it, because the workforce isn't there. What we need to start doing is defining that level of care. And those people who are most vulnerable and maybe in a crisis state, get those to those level of providers, because there's not enough of them, and build a different workforce and think about treatment in a different way. And so some of the things I'm starting to suggest as I travel is building safe spaces in communities. It doesn't require a certain credential to create a safe space. It requires a certain personality. And we're starting to see these spaces pop up. We have the Coffee Break Project in Rocky Ford. Last week alone, we had 50 visitors. None of these are clients. These are people in the community that just come in and want to connect. I had a person catch me in the street at the Swig store Tuesday morning, had never been there. Said I was having a rough day. I needed a place to go. Somebody said I could get free coffee and a donut. I went there. I stayed an hour and a half. And when I left, it didn't fix my problem, but I knew I could get through the day. And now I have a place I know I can go. Our peer houses, we're trying to put peer communities or peer houses every 30 minutes or 30 miles through our catchment area. Again, how do we draw on people with recovery experience? How do we draw people in that just have a passion to create safe conversation and safe space? That doesn't mean they're counselors. They're not providing that level of care. But we create safe environments. In those safe environments, then we can screen them and see if they're deteriorating or they're more complex patients or have more complex issues. We can then refer them to a higher level of care. But we can't continue just to throw all of the behavioral health issues at counselors and expect them to fix it. There's just too much need. There's too much complexity. And I think we need counselors to work at their type of their license because of the shortage we have. So we can train gatekeepers to be more involved in their communities and create these safe spaces. So for example, and I'll end with this, AG, we have a program that comes out of the University of Colorado called COMET, Changing Our Mental Emotional Trajectory. We've trained in the last 2 years 150 people in Southeast Colorado. It's basically just a conversation starter to check on people that you run into at the post office, at the C-store, the feed store, the lumber yard, church, whatever it is. And it's just a gentle conversation to check on people. Well, those 150 people have been trained. Let's conservatively say that we encounter in our personal lives 50 different people in a week through whatever we do. That's 7,500 encounters in 1 week. There's only 49,000 people in Southeast Colorado. So in theory, in 1 week, we can check on 1 out of every 7 people in our 6-county region. All of a sudden, those gatekeepers are the ones having the conversations, checking on people, encouraging them. Are you going back to church? Have you talked to your mother? When's the last time you went to card club? Do you need to see a therapist? Do you need crisis? We got to create a different narrative on how to get ahead of this, because just by expecting more of this next generation to be healthcare providers, it's not happening. Nursing's got a shortage, docs have got a shortage, behavioral health's got a shortage. We've got to rely on our community members to become gatekeepers and the eyes to help screen our communities.
I love everything you said, although I'd probably change the word gatekeeper to something else.
Okay.
I don't know what the right analogy is, but it feels like it's more empowering and positive, where gatekeeping feels like something. So I'll thank you. I have suggestions for JC in that, but I thought that was
blow up my email if you got
amazing. And I I want to underline something you said because I think it's worth saying. Part of what's happening, I think, right now, you mentioned people going to church, is we have a connection crisis in this country. So the Surgeon General called it actually an epidemic of loneliness. 30 years ago, Robert Putnam, I mentioned one great book called The Body Keeps the Score. Another one is called Bowling Alone. And he said in the 90s versus the 50s, people were in bowling clubs, but more apt to be bowling alone, not in groups. People are less apt to be a member of a church, less apt to be a member of a sewing club, less apt to be a member of a card playing club. The less connection people have, the less people are feeling like they can check on each other, because a lot of those 50 interactions, people aren't connected. Hey, how are you doing? No, how are you really doing? Like, they're not having those conversations where 40 years ago, there was more authentic connection. People were better mentally, health-wise. Now, people are on their devices feeling like inferior to other people or disconnected and or be getting fed dangerous content. So we have a different challenge today than we had in the past, and I think there's a lot of components. I'll add one more. I take it your school district 4 days a week, probably?
Most. Yes.
Most around here? What's that fifth day look like for kids?
They're
on their devices. So that's part of what we're up against. What if you had people in that fifth day going fishing together, or doing some, law enforcement training work, or doing some nursing apprenticeship work? That's a different type of, again, emotional development for kids than what they're getting on their devices.
The comment about connectedness is great, because if you look at when I grew up in the 70s, we ate a meal together as a family 5 days a week. In the 80s, it was probably 2 or 3 times a week, and we started going out to dinner and would sit down in a restaurant, right? In the 90s, it became fast food. 2000s, it became the drive-through, and because of COVID, it's delivered to us. We don't even leave our home. So just over the course of 5 decades, I've seen that connectedness totally change, where people deliver groceries to us, they bring food to us, we don't even have to go out. That doesn't help with the connectedness that we need to do to support our community. So, thank you.
Thank you.